I'm Daniel Flores, and I live in American Falls, Idaho. I'm 61, almost 62. We was going back and forth from here in Texas, and one year I got back up here to Texas and got married and started a family, and then came back here, and I've been here since then. We love American Falls. It's been for us a real good town. I'm a farm worker all my life. Since I was 12 years old, I've been working on farm, tractors and farm labor. That's my thing. Here in Idaho, we've been raising potatoes, beets, corn. Well, I was feeling, in the mornings I was okay. By 11 o'clock I was just shaking and wanted to faint and stuff like that. So I just couldn't figure out what was the matter with me. And came and see the doctor came and see the doctor. They couldn't find nothing with me at that time. And then I had an accident. I cut my finger, and they put me in a hospital overnight, and that's when they found it. At that time it was 750. My sugar was that high. Too expensive, everything, you go and see a doctor, and just the visit, it just is real high. For me that I don't have insurance, it's just so high. And then, sometimes I would run out of insulin or whatever, pills or whatever, and I couldn't afford it, so I went out without it for a week or so, and then I started up again.
Did that happen a number of times?
Oh yes, quite a few times, because it just hard. Yes. My boss tried to get me insurance from Blue Cross once, and I didn't qualify because I had diabetes. And then he tried again, and the insurance was somewhere $200 a month. And then after a while, I had a heart attack, and that raised her up to about $500 or $600 a month. So I just couldn't afford it. About $1,600 or a month, something like that, to support my family and send them to school and buy them stuff. It was just too much for me and have insurance. I would say everything hurts, but especially, my legs start giving up on me, hurting a lot. Then my eyes, I'm almost blind right now. And I try to put an appointment just today, because the doctor told me you need an appointment. But because about 4 years ago I went and see him, and I couldn't pay everything, and I got behind. I didn't work enough. They put me on a collection, because I couldn't pay my bill. They couldn't get me an appointment because they can't see me, because I owe them. Like right now, I lost my foot. I owe them more than $100,000 right now. How can I pay them? It was the doctors and the hospital. Yeah, and I'm trying right now to see who can help me. Welfare or county again. I just don't know, I owe money to the county because I had liver problems, gallbladder, and a heart attack. I started owing them $42,000, and I'm down to about 20 right now. 15 years.
15 years
that I've been paying.
This
Yeah.
debt you've been paying gradually down.
Mm-hmm. My boss, after worked for him for 27 years, he let me off.
How old were you then?
62. We were just Recently, yeah, it was in October, yeah. Disability already sent me a letter that I qualify for a check, but insurance for my health or for stuff like that, no. They said that I didn't qualify. Well, right now I'm supposed to be having my prosthetic, how you call that, my foot, but just because I don't have insurance and just because I don't have the money, I have to stay on my wheelchair.
You know how much it costs?
13,000, I mean. Well, now that I don't work, now that I can't work, I feel, that I let them down too, because so I let them down. That's how I feel.
Daniel can't get the prostheses he needs to walk.
Can't go out to stores or stuff like that. When I used to go, that I miss that. People that don't have a leg or an arm or whatever knows how it feels. It is, but I wish they can do something to reduce the cost of insurance, help us a little bit more. And it's hard. That's all I can say. It's very, very hard.